Hi, my name's Tanya Babitch, and I'm a manager in the Risk Management Department at TMLT. A patient's perception of the care that they receive from a physician's practice is influenced by many factors, including what they see and experience before they ever meet with the physician. Today, we'd like to offer you 8 tips that can help improve patient satisfaction. Tip number 1, create a positive, open, and comfortable office space. The first thing that your patients see when they come to the practice is likely going to be your reception area or waiting room. Ask that your staff walk through once or twice a day, reorganizing furniture that may have been moved, cleaning up any trash that other patients may have left behind, and tidying magazines. If you have signs posted in your practice, make sure that they are professional in appearance and that the font's large enough to be read by your patients. Tip number 2, ensure that patients with disabilities can easily navigate your office. The ADA requires that medical facilities be accessible to all patients. Move your furniture so that the area is easy to navigate and that there are no barriers to patients. Tip number 3, ensure that you have adequate seating for all patient populations. Keep in mind that pediatric patients, elderly patients, or larger-bodied patients may have different needs. Make sure that you have adequate seating to accommodate any of your patient populations. Tip number 4, manage your public-facing staff members. Our experience is that a negative patient-staff encounter can poorly reflect upon the physician. Take a look at your practice. The receptionist is the first person that the patient is going to interact with. Are they warm, friendly, welcoming? Phone etiquette reminders, written protocols, and staff training are very helpful. Tip number 5, always acknowledge a patient's arrival. If they're helping someone else, remind your staff that they should pause and take a moment to greet the patient that's just arrived. Your patients are your customers, and nothing frustrates a customer more than failing to be acknowledged. Taking these little steps can make patients feel important and valued by your practice. Tip number 6, keep private conversations between patients and staff truly private. Train your staff to take patients to a designated private area when there are sensitive conversations to be had. In addition, make sure your staff understands that their interpersonal conversations, especially any disagreements, should never be held in a place where patients can hear them. Overhearing these kinds of conversations may make your patients feel like they're not the top priority in the practice, or that your practice is poorly run and has unhappy employees. Tip number 7, continually evaluate your practice. One useful evaluation method may be to employ a colleague or friend to act as a secret shopper. Ask that they go through the process of scheduling and keeping an appointment with your practice. Then ask for their honest feedback about where your strengths and weaknesses may lie, and then act on that feedback. In addition, patient surveys, whether they're electronic or paper, can be very useful. Make sure that if you're using surveys, that they're easy for patients to access. Tip number 8, be sure to compliment your staff. Make an effort to compliment your staff who go out of their way to make patients feel valued and comfortable. Giving your staff this feedback encourages the team and keeps morale high. We hope that these tips will help you create a great practice environment for your patients. Thanks for watching. For more information about TMLT's risk management, visit us online.